By the end of this video, you're going to have 4 different split squat variations that you can use to get out of chronic knee pain right now. Not only will these exercises give you chronic pain relief at no cost, but they will also help you to be more functional, grow stronger legs, get bigger glutes, and improve the quality of your life. My name is Dr. Michael Vancheri, and I am a drug-free, non-surgical chronic pain specialist in New York City. Knee pain can ruin your life. It prevents you from running, playing with your kid, participating in rec league softball. So much information on how to fix it out there that you're not really sure where to start. Get to the gym, grab your pair of dumbbells, throw your knee brace away because it's time to get to work. The regular old split squat is our first variation of split squat to improve your knee pain. So what you're gonna wanna do is stand, feet shoulder width apart, take one big step out forward. With this back leg up on your toe, you're gonna keep your torso upright, sink down, drive this front knee over your third and fourth toe, initiate the squeeze with the glute, and come on up. Nice and slow down, kiss the ground, come on up. You don't want to collapse. You want to imagine your upper body into a phone booth, right? Not much room in that phone booth for those of us who remember what phone booths are. This will generally strengthen the glutes. It will generally strengthen the quads. It will give us a nice baseline to progress off of in order to continue to utilize the split squat and its variations to reduce knee pain. And when you feel comfortable, load these with light dumbbells. The elevated quarter pistol is the next movement. Again, this is another movement made popular by Ben Patrick at Knees Over Toes. Does wonders at tensioning the patellar tendon, also does wonders at improving ankle flexibility. Both things needed for healthy knees. You'll come to the edge of the plate. Depending on how strong you are, will dictate how high the plates go. You'll bring the other foot off. You'll slowly lower until that bottom heel just kisses the ground, and you'll come on up. What you don't want to do is slide your hips out. You want to keep your pelvis as even and equal as possible. Nice and slow, controlled, own every inch of that range of motion. If you are looking to bias the patellar tendon even more, grab yourself a slant board. With the slant board, you will also get load on your meniscus, which if you do shockwave therapy, kill the senescence, have a healthy metabolic environment, you can begin to regenerate the meniscus in the right conditions. Load these for better ankle flexibility gains and load these for more tension on the patellar tendon. The rectus femoris rear foot elevated split squat. Instead of doing a normal rear foot elevated split squat where you sit down, straighten your leg out, pop up, and then place your back leg there and sitting, what you'll want to do is actually narrow your stance by about a foot's length. Sit through there, and as you come down, what you'll want to do is sit as deep as you possibly can into this movement. What this is going to do is put a tremendous amount of tension, tremendous amount of length on this rectus femoris muscle, this anterior quad muscle, and pop back up. The slower you do this, the more tension you'll put, the more length you will gain with this movement. Load when you feel comfortable for maximum flexibility gains. One important thing, we don't want to let our back arch like this. Keep everything nice and neutral. At the end of this movement, squeeze your glute, up the back leg as well, and pop back up. The ATG Split Squat, which is a split squat used primarily by Knees Over Toes Guy, this one is going to be more focused on improving flexibility through the joints of our lower leg. What you're going to do is lunge out. You're gonna wanna go nice and far here, further than the typical split squat. And the whole purpose of this split squat is to lean forward as far as you can. You see my knee is comfortably over my toe there. I've got more hip flexion happening in through this hip. I've got more ankle dorsiflexion happening in through the ankle, and I've got more knee flexion happening, right? The ideal goal of this split squat is to basically get your hamstrings flush with your calves. Now, my ankle flexibility needs some work. I cannot do that. If you also cannot do that, there's another variation on top of that that can enable you to get deeper. You're going to utilize a weight plate to elevate the foot to get more depth here with less ankle dorsiflexion. So if you've got bad ankle dorsiflexion, this will be a nice regression to the ATG split squat. So you'll step in through that. You'll lean forward as far as you can, as much bend in the ankle as you can. Try and get that nice and close. As you can see here, I still don't have the ability to do that. I would take another plate, stack it up even higher. Another important thing is to keep that back knee off the ground. This will enable you to get more of a hip flexor stretch in through the back. Load these when you feel comfortable, because the load of this movement, the dumbbell, will actually improve range of motion faster than just with body weight. You will get a bigger stretch and a faster, more effective change with load, but only use load when you're comfortable at body weight. Bonus tip. If you're looking to optimize your results, use these 2 stretches as a warm-up before doing the split squat. It'll be best practice to execute these exercises in the order that they are presented. You're going to want to do feeling comfortable, or if you hit a plateau with the body weight style of these movements, begin to load them. Start with 10 to 15% of your body weight and progress to around 33%. If you're an average weekend warrior, 33% should be more than enough for you to get knee pain relief. If you're an advanced lifter or an elite athlete, you may even want to progress to 50%. Work in rep ranges from 6 to 15 if you're just doing body weight. If you are loading them, work in rep ranges from 6 to 12. Do 3 to 4 sets of each exercise on each leg. Do these exercises no more than 2 to 3 times per week. You can still make progress with once a week, but 2 is more ideal. Before we finish, let's talk about when you need to see a doctor. If after 4 to 6 weeks you see no improvement after doing these exercises in your chronic knee pain, go ahead and reach out to a chronic pain specialist. I'll go ahead and throw a link in my bio to my website and a website that will list similar providers for you. If you just hurt your knee recently and you heard a pop snap where your knee was completely healthy one day, you did something and now it is unhealthy, go see your doctor. Do not try these exercises. If your pain exceeds a 4 out of 10 discomfort while doing these exercises, go see your doctor. If your pain worsens while performing these exercises, go see your doctor. If anything about these exercises feels off or odd, or you get an uncomfortable sensation that you are unfamiliar with, go see your doctor. As a general rule, if you're not sure if you should see your doctor, go see your doctor. It's important to rule out any big structural changes like advanced stage arthritis, torn meniscus, a torn ligament, or a torn patellar tendon. If you like this video, go ahead and hit that subscribe button. I will also link a playlist in this corner that I've specifically designed for you in order to further help you get out of knee pain. Pay particular attention to the range of motion testing that I've put in that playlist. Test your range before embarking on these split squat exercises, and then test your range after embarking on these split squat exercises after about 4 to 8 weeks. See if your range is improved. Go ahead, come back to this video, leave me a comment, let me know. Thank you for taking the time to watch this video. Go utilize your new pain-free knee function to make a difference. And remember, pain-free people change the world.